Hello everyone, welcome back to the channel, The Upcoming Doctors. So in today's session we are going to discuss about the part 2 of acidosis and alkalosis. So let us get started into the topic without any delay. So we have here the arterial blood gas analysis, right? This is a ABG analysis. The normal values are actually very important, so you need to remember all these values. So already we discussed the pH of the blood should be 7.35 to 7.45. This is a normal range, and whenever the blood decreases less than 7.35, that's called acidosis, and whenever it crosses the 7.45, which is greater than 7.45, that's called alkalosis. Okay, and then coming to the H plus level, which is nothing but 35 to 43 milliequivalent per liter. And then coming to the CO2, which means partial pressure of the CO2, we have the normal value, that is 35 to 45 mm of Hg. This is not HTG, this is of Hg, right, of mercury. And coming to the PO2 level, which is nothing but 85 to 100 mm of Hg is the normal value. And bicarbonate having the 22 to 26 milliequivalent per liter, whereas average is the 24, right? This average is 24 and PCO2 average is 40. So by this we have more importance to pH, PCO2 and then HCO3 minus, that's a bicarbonate ion, because based on this we can decide whether it is a metabolic or respiratory, whether it is acidosis or whether it is alkalosis. This are very important, right? So please this is mandatory to learn all the normal values. If possible, you learn the SI units also, because only two values are differing here. One is PO2, another one is a PCO2. So please go through it also. We have the PCO2 if it is less, because the CO2 is related to what? Respiratory. So in respiratory acidosis or alkalosis only the CO2 gets changes, right? Whether in the metabolic acidosis or alkalosis, the PCO2 will remain normal. Up to this we have discussed in the last class. And coming to the bicarbonate ions, it is completely related to the metabolic one. That's why in the respiratory acidosis or alkalosis, the HCO3 minus ions are normal. So we can discuss in detail what all these four conditions mainly involve. We are coming to the first one, that is the respiratory acidosis. Okay, respiratory acidosis means what? Respiratory. What is it in for? Yeah, it is related to the lungs. And acidosis means the pH is less than 7.35. So it is called acidosis. And what will the causes of this respiratory acidosis means? Decreased respiratory stimuli. That's why the CO2 is not getting out of the lungs. So there will be accumulation of the CO2 in the lungs. So there we can see the increase in the CO2 in the lungs. And then pH also get decreases because CO2 is getting increased, that is acidic in nature. So definitely the pH get decreases. And we can see the retention of the CO2 by the lungs in this patient. The patient will not catch his or her breath, and the symptoms are drowsiness, dizziness, disorientation, muscle weakness, hyperreflexia. All this can be seen. And mainly in the causes, anesthesia may be one of the causes, and drug overdose, pneumonia, atelectasis, COPD. All these are causes of this respiratory acidosis. And mainly we can see one point here. We see that the CO2 is not getting out of the lungs, so the CO2 will be retained in the lungs. Definitely what will happen? The hypoventilation can be seen. So it ultimately leads into the hypoxia, which means oxygen supply also get decreases. Okay, CO2 is increasing and oxygen is decreasing in this point of view, which means the respiratory acidosis. And the patient will have rapid shallow respirations, decreased BP, dyspnea, right? The breathing will not be proper, and he may face the headache. Hyperkalemia, this is one of the very important, it can be asked as MCQ also in respiratory acidosis, whether we can see hyper or hypokalemia. It's a hyperkalemia, please remember it. We can see the dysrhythmias also because of the hyperkalemia, which means increase the potassium. So this is all about the respiratory acidosis. So let us discuss about one more condition, that's metabolic acidosis. So the metabolic is related to the kidney, right? The metabolic is related to the kidney, which is something related to the kidney. And acidosis means the pH is getting decreases, again less than 7.35. And what mainly we can see here is the pH is getting decreases because its acidosis is less than 7.35, and it is metabolic. That's why the HCO3 minus ions, which means bicarbonate ions, are also getting decreased, right? Normally we have one funda, that's H plus H2CO3 is present. Now this H2CO3 gets divided into H2O and CO2. Again we have another thing, that H2CO3 is divided into H plus and HCO3 minus ions, right? This is all about the H2CO3 dissociation. This will happen and the H plus and HCO3 minus will be present. This should maintain the equilibrium. But what is happening in this metabolic acidosis means there is too much of acid, which means acid means H plus ions, and too little of bicarbonate. That's why it leading to the metabolic acidosis, which is related to the kidney, right? And the patient may has headache and decreased BP, hyperkalemia. In both acidosis, whether it is metabolic acidosis or respiratory acidosis, we can see the condition that's called hyperkalemia. This can be asked as a MCQ. Please remember this point. This can be asked as a MCQ. The metabolic acidosis and the respiratory acidosis, we can see the hyperkalemia as a feature. And the patient may has muscle twitching, warm fleshed skin. Why the skin is so warm? Because of vasodilation. This HCO3 minus is getting decreases, and but H plus is more and more, no? That's why acidic in nature. So the vasodilation may happen, and the patient may feel also the nausea, vomiting, and very characteristic feature is the kusumal respiration. This is also can be seen. Okay, because of hyperventilation, the too much of acid is produced in the body, nothing but the CO2. It should get out of the body. So a compensatory hyperventilation can be seen in this patient. And mainly we need to discuss about the causes of metabolic acidosis. What are the causes? We have the increased H plus ions that already discussed. It may be seen in the DKA, which means diabetic ketoacidosis, we can see. And in the renal failure conditions, dehydration, liver failure, diarrhea, fistulas, all these conditions we can see the metabolic acidosis. And we also see the hypotonia, which means the decrease in the muscle tone and decrease in the reflexes. This is all about the metabolic acidosis. So the next one is the respiratory alkalosis. So by this condition we are going to understand that respiratory is again related to the lungs, and alkalosis definitely the pH is greater than 7.45, because the normal value is from 7.35 to 7.45. So the patient may have the pH get increases and PCO2 is decreasing, because more amount of CO2 is getting released from the lungs because respiratory, no, that's why. So loss of CO2 from the lungs, it may cause like hyperventilation is one of the cause, right? Hyperventilation can be seen in this patient. More deep and rapid breathing is the one of the cause, which means it results in the hyperventilation. And the heart also beats very fast, which means tachycardia greater than 100 beats per minute. And BP may be normal or can decreases. And yes, this is a point where we need to understand the hypokalemia condition can be seen in this respiratory alkalosis, because we already seen in the respiratory acidosis and the metabolic acidosis we saw the hyperkalemia is the one of the condition, but here in the respiratory alkalosis we are seeing the hypokalemia, right? And numbness, tingling of the extremities can be seen in this patient, and lightheadedness, nausea, vomiting, lethargy, which means confusion, okay, tiredness, all these are seen in this patient. But main causes, one of the causes, hyperventilation, deep rapid breathing is seen. In such conditions, when we take the deep rapid breathing, definitely before the exams, no, right, that's anxiety, fear, then mechanical ventilation, because we can feel our breathing. Normally the breathing is an involuntary action, we can't each and every breath we can feel it, right, voluntarily, but in that time we can feel our breath, because that much rapid and deep breath we can take. So one of the conditions is not, I just said for example that before exams we can feel all this condition of the respiratory alkalosis patient, but in the hyperventilation cases we can see this condition that's called respiratory alkalosis. Just for example I said in front of the exams, okay, please remember it. And the last one we are going to discuss about is metabolic alkalosis. And what does this has means? We have metabolic means it is related to the kidney, right? And then alkalosis means definitely the pH is greater than 7.45. And metabolic means here the alkalosis, no, that's why metabolic means bicarbonate and increase in the bicarbonate ions. So decrease in the acid, just reverse of the metabolic acidosis, because in that there is more acid, but here there is less acid and more base. Okay, we have the dysrhythmias again, and confusion may be experienced by the patient. Decreased LOC, and now what does it mean? Means loss of consciousness can be decreased, dizziness, irritable, nausea, vomiting, right, tremors, muscle cramps, and hypokalemia. So you need to remember in the metabolic alkalosis we are seeing in the metabolic alkalosis, and another one what? Yes, we already seen that in these conditions, respiratory acidosis and metabolic acidosis, we saw the hyperkalemia condition, and respiratory alkalosis we saw the hypokalemia, and metabolic alkalosis we saw the hypokalemia. So you need to understand, I'll make a thing, which means first of all we are seeing the hypokalemia and the hyperkalemia, because ultimately you need to remember in which conditions we are seeing this hyperkalemia and the hypokalemia. So whatever it may be, metabolic or respiratory, if it is alkalosis, then we can see the hypokalemia, right? Hypokalemia can be seen where it is metabolic or respiratory, but it is acidosis, then we can see the hyperkalemia. Please remember this point. I'll repeat again. In the metabolic alkalosis and the respiratory alkalosis, you can see the hypokalemia decreased in the potassium ions. But in the conditions of respiratory acidosis and the metabolic acidosis, we can see the hyperkalemia condition. So this is very important, increased in the K plus ions. Please remember these 2 points. This may be asked as a MCQs, or it can be helpful, okay. And then restlessness followed by the lethargy can be seen in this patient. Compensatory hypoventilation we need to do, because here the acid is decreasing, no, that's why hypoventilation. We should not that much, we need not to have that. So the causes are severe, the causes in each and every condition, the causes are very important. Please remember the causes, conditions, which means the symptoms of the condition. And then the severe vomiting may be one of the cause, using the diuretics, excessive GI sectioning, okay, and excessive NaHCO3, sodium bicarbonate also, because increased in the bicarbonate, if you take sodium bicarbonate, there may be chance of splitting out, like means splitting of sodium and the bicarbonate ions. Ultimately the bicarbonate ions are getting increased. Already the bicarbonate ions are very high in this condition, so you should not take the sodium bicarbonate again. It can lead to more complications. This is all about the 4 conditions. I hope you understood something from this video and got helpful. Thank you so much for your support, and please subscribe to the channel, because for notes you can join the Telegram channel or follow my Insta ID, that's the upcoming doctors. There also I can post some more interesting points. Yes, thank you so much for your support. Thank you.